Now we have an excellent speaker coming up here, as you can see standing to my left, Ms. Emilia Collavini. Emilia is a registered respiratory therapist, a certified respiratory educator, and a tobacco cessation educator for Fraser Health Authority. She works as the clinical resource educator for Community Respiratory Services, which is a program that oversees the home oxygen program, provides education and support to clients at Fraser Health. So please help me welcome Ms. Emilia Collavini.
Good afternoon, and thank you for asking me to come and speak to you. And you did a great job in pronouncing my name. Thank you, Darcy. So I was asked to talk about oxygen, as you see my title here, Do I Need Oxygen? And it actually should probably be changed to, Do I Need Supplemental Oxygen? I was practicing this presentation with my my adult child, and he kind of looked at me and goes, duh, of course you need oxygen. So it's actually giving you the details for those who are not aware about what is involved in getting home oxygen or supplemental oxygen. So in the time I have with you, I'm going to be talking about why you may need home oxygen, details about the home oxygen program, some specifics about the oxygen equipment you'll be asked to be using to give you that supplemental oxygen, and some details also about how to live with oxygen, and time for questions and answers. So we're talking about oxygen. And like I said earlier, do we need it? Of course we do. It's around us as we're sitting here. It's in the air that we're exposed to, and it's used by your body as fuel. Okay? It's kind of the gas of your engine of your body. Your organs and your muscles require it to function properly. And how do you get that oxygen into your bloodstream or into your body? That's through the act of breathing. So as we're doing right now, as we're breathing in, we're breathing air in through to our lungs, through the air tubes, and more importantly, into the air sacs, or what we call the alveoli. And when the air is in the air sacs, the oxygen molecule moves through the skin of the alveoli into your bloodstream. And once the oxygen is in your bloodstream, it attaches to red blood cells called hemoglobin, and that becomes saturated, and then your heart pumps it through the rest of your body to be used by your organs and your muscles. In certain health conditions, including COPD, the amount of oxygen that moves through the lungs into the body's bloodstream decreases. So as your lung condition progresses, there may be a possibility that the amount of oxygen going into your bloodstream will drop, that you will now require supplemental oxygen. So how do you know that you have low blood oxygen level? And the medical term is called hypoxemia. The way to know is through testing, which I'm going to go through, but really what you're going to be realizing is your body's giving you some some hints that you are having low blood oxygen level. With COPD, you normally have episodes or issues with shortness of breath. So that is your usual condition. But eventually you'll get to the point where you're doing your day-to-day function, and all of a sudden it's becoming more difficult. Those stairs are much more challenging than they used to be. Walking on that flat surface, you're now having to stop more often. Maybe doing your household chores are more difficult to manage. You're having difficulties thinking clearly, difficulties with concentration, maybe even waking up with episodes of struggling to breathe. So that's your body telling you that maybe your oxygen level is too low. And you, as the person suffering from COPD, may not even be noticing this because it's so progressive as it slowly happens. But your family, your friends, your loved ones may notice this, and they're going to prompt you to go see your family doctor. And when you go see your family doctor is going to have to sort of decide, is this just a progression of your lung disease, the difficulty of you managing to move air in and out of your lungs, or is it because you have low blood oxygen level, or are you hypoxic? So your physician or your nurse practitioner is going to send you for a test, and it's called a home oxygen assessment. And that's typically done in an outpatient clinic in a pulmonary function lab in a hospital setting. Or if you're so short of breath that you can't get out of your house to a clinic, you may have someone come to your home to do the testing for you. One of the tests to tell if you have hypoxemia, and you see that image there in the left, is called an arterial blood gas. So that's done by a respiratory therapist, and they take blood directly from your artery in usually the wrist area, and that blood test is tested to measure how much oxygen is dissolved in your blood, and also will measure how much of those red blood cells, that hemoglobin, is carrying oxygen. Okay? But the more common way people get tested for hypoxemia is pulse oximetry, and I'm sure looking here and out onto the live stream community, a lot of people are aware of this. And thanks to COVID, a lot of people now know what pulse oximeters are. And what a pulse oximeter does, it shines a light, a sensor goes placed on your finger, and it shines a red light through your finger. And the machine measures how much of that light has been absorbed or blocked. And what happens is it will take that measurement, makes a calculation, and then will display how much your oxygen saturation, or SpO2 value, is. So it gives you the calculation of how much of your red blood cells are carrying oxygen. So if you're 95%, that means 95% of your blood is carrying oxygen. If your oxygen level is 87, that means 87% of your blood is carrying oxygen. And how we measure your oxygen saturations is when you're sitting down at resting or when you're moving, and that's called a 6-minute walk test. And that walk test is you walking on a flat surface for 6 minutes without oxygen and possibly with oxygen. And then you may also be sent home with a pulse oximeter to measure your oxygen level while you're sleeping at nighttime to see if maybe you're having problems with your oxygen level while you're sleeping. These test results are going to be sent to your ordering physician or nurse practitioner, and then if the results show that you need oxygen, that's when it'll be prescribed. And why are we going to be prescribing the oxygen? Because having supplemental oxygen is going to improve your exercise tolerance, your sleep, and your quality of life. It's also going to improve that feeling of fatigue, and for some people actually improve their shortness in breath. It's going to also improve your heart function. And I underline that to sort of stress this point. If your body requires a certain amount of oxygen in your bloodstream, but if it's too low, there's not enough oxygen in your bloodstream, then your heart has to compensate by moving what blood or oxygen that's in your bloodstream around. And so it's going to be, you're asking your heart to do more work. It's like driving your car at 5,000 RPMs. You're going to stress it out after a while, okay? And then oxygen, with all the research, has been shown that it prolongs your life, even though it cannot improve your lung function. So think of it this way: you have a low oxygen levels in your bloodstream, you're given supplemental oxygen to be able to bring that oxygen level up, because the air around you, you're just not able to absorb enough of that oxygen, and you will not be able to get enough into your bloodstream. So, if you may notice, I mentioned earlier that your doctor is going to prescribe you oxygen. So this is something very important to understand, that supplemental oxygen or home oxygen is a prescription medication. And with all prescriptions, there is specific criteria indicating its need. So you may see here, and it doesn't show up very well, this is the criteria that you have to have in your blood test results to show that you require home oxygen. So to make things really easy is, if you did have an arterial blood gas, your oxygen, your PaO2 is 55 millimeters of mercury or lower, or more importantly, your oxygen saturation has to be 87% or lower in specific situations, either when you're resting, when you're moving, or possibly when you're sleeping. And if those test results fall in that criteria, you will now be able to be approved for oxygen funding through your home oxygen program. So your family doctor is going to sign this application, fill that all out, and we'll send it to your health authority's home oxygen program. And there, the test results, along with the application, will be reviewed, and then they give the big rubber stamp of saying, yes, we're going to fund your oxygen. And then you're going to be attached to an oxygen vendor. And the oxygen vendor are the companies assigned to provide the oxygen equipment that you will be using. And the companies here in British Columbia are Vital Air or its subsidiaries, or MedPro. Now, we're going to talk about oxygen equipment and how it's determined about what oxygen equipment you'll be given to use. Oh, sorry. Thank you. Thank you very much. My apologies. So the oxygen equipment you're going to be given is dependent on your oxygen prescription. So an oxygen prescription is the flow or the dose of oxygen that you require, which is called liters per minute. And also, it's going to be a prescription of when you need the oxygen. Do you need the oxygen when you're resting? Do you need the oxygen only when you're moving? Or do you need the oxygen when you're sleeping at nighttime? So let's get into the details of the oxygen equipment. So you see here on the left is what we call an oxygen concentrator. It's given to people who need oxygen mostly on 24 hours a day, when you need it at rest, on exertion, and when you need it while you're sleeping. And what is an oxygen concentrator? It's just a big compressor or a generator. As I mentioned, we have oxygen in the air that's around us. It's 21% of that is in the air that's around us. The rest of it is nitrogen or some trace gases. So a concentrator will pull the air that's around us, pull out the oxygen, and then pass that on to you as the person with COPD needing to use that oxygen. And this machine requires power for it to be operational, and it's not the most portable. It's about the size of a bedside table. Okay? And the big thing to know is the oxygen that's prescribed or provided is it's continually flowing. So when you breathe in, there's oxygen, but also when you're breathing out, oxygen is present in your body. Next, we're going to be talking about oxygen for portable use. So if you have a concentrator at home and you're using that in your home, what are you going to use when you leave your house? So you're going to be given oxygen for portable use. Or if you need oxygen just on exertion, then you're just going to be given a portable system because you want to use it within your home and then when you're outside of your home. And two systems are your oxygen cylinder or your portable oxygen concentrator. So an oxygen cylinder is just this. This is one of the smaller versions of an oxygen tank, and what you see here is your oxygen regulator. And this is a specific amount of oxygen in the canister, and I don't know if the camera can see this, but there is a larger tank here, and as you can see, there's various sizes, and what size you will be given is dependent on how much oxygen you require. The larger the tank, more oxygen you're able to carry around. But you can imagine this is a lot easier to carry versus something as big as this, right? So that gets us thinking of portable oxygen concentrators. And I see some examples of that being used here today in our meeting room. And a portable oxygen concentrator is just what it is. It's named. It's an oxygen concentrator, but it's for portable use only. So that runs on a battery, and it takes the air around us, pulls the oxygen out, and gives it to the patient, which is fabulous because that, in theory, gives you an endless supply of oxygen as long as you have power in your battery and or a means to plug it in. So it's fantastic from that perspective. So the portable oxygen system that is given to you is dependent on what your oxygen flow rate is, and if you need oxygen on a continually flowing method or on a pulse mode method. So what I mentioned earlier, continually flowing is the oxygen's blowing when you breathe in and when you breathe out, but pulse mode is the oxygen is only given when you breathe in. And for some people, their COPD is so advanced, it's not able to give them enough oxygen to maintain their oxygen level in their bloodstream. And lastly, we're going to be talking about liquid oxygen. And liquid oxygen is a setup where you are given oxygen in a liquid form, and it's usually given to people because they need oxygen at higher flows, 6 liters or more. Having the oxygen in a liquid form allows you to be able to carry more in your portable oxygen device. The difficulty with that is the oxygen in the portable device will eventually evaporate, so you need to fill the portable carrying device from the larger unit that you see here on the left. So how are we living with oxygen? All right, so you now have oxygen, and it's funded by your health authority, which means that you will have a respiratory therapist come and visit with you on a regular basis. They are coming to see to check to make sure that the oxygen is still required, or more importantly, does the oxygen need to be adjusted? Do we need to make some changes in your prescription? Do you need less oxygen or more oxygen, and dependent on if there's been changes in your lung condition? Importantly, oxygen is, some people call it flammable, but it's not actually flammable. It supports combustion. So think about when you were camping and you would blow on that campfire as you were trying to get it started. You're introducing oxygen to increase the flame so that it'll burn hotter and it'll ignite what you're trying to burn. That's what happens with oxygen. It supports combustion. So if there's any sparks, that spark's just going to be a lot intense and potentially cause a fire risk. So that's why you have to be safe in making sure that you're not around any open flames, or your oxygen equipment is 3 meters or 10 feet around that. And as you see in red, it's very important that you do not smoke if you have oxygen. If you are an active smoker, you will not be denied oxygen. We just have to make sure that you do not smoke with the oxygen on for your own safety, because it is a fire risk. And also, more importantly, it's a fire risk not only to yourself, but to whomever is around you. So it's important that you do not smoke with your oxygen on. And strategies to how to live with oxygen. I see some great examples here of people using devices to help them move their oxygen around. I showed you your oxygen cylinder. It might be too heavy eventually for you to be able to carry, so you might need some tools to help you with that so you can move around. The oxygen, yes, prolongs your life and improves your life, but we want to make sure you have an excellent quality of life, so that means we want to be able to have you be able to use the oxygen and still move around. So that might mean getting a backpack to carry your oxygen tank, or even one of those little grocery carts. Or if you have a walker or need a walker for your balance, then you're going to put it in a basket now, because that way you can carry the oxygen and be able to move and still have a life. Along with that is, it does take some pre-planning when you do have home oxygen. And what that pre-planning means is you have to determine, how much oxygen am I going to need when I'm on my outing? Do I take 1 oxygen tank or 2 oxygen tanks? Is my batteries for my portable oxygen concentrator fully charged? I have a lot of appointments happening this week on your calendar, in terms of social activities, medical appointments. So you may call your oxygen vendor and ask them, can I make sure that I have enough oxygen tanks so you can get out of the house and run your errands? And along with that is, when you're traveling with oxygen, you may have to determine what your oxygen needs are. So when you're flying, you can ask your airline what specific equipment is required, so that way you can be able to fly safely in the airplane, but have the right oxygen equipment from that perspective. And not only that, you need to figure out with your oxygen vendor some pre-planning. If you're traveling through the province, you may be connecting with them and asking them, can you drop off an oxygen concentrator to my vacation home so I could have it there instead of me physically bringing it there? Or else you talk to them about, how do I safely transfer my oxygen concentrator in my vehicle from that perspective. So thank you very much. Is there any questions?
I've got a portable oxygen concentrator anyway. So sometimes I use it, I don't have my real concentrator. So if I plug it in at night, can I put it on continuous? Would that be okay? I know that my battery will run out really quick if I put
Exactly,
it on
yes.
continuous.
So portable oxygen concentrators are not really meant to be used continually. So I would not advise it for long term, but if it's for short term, for a single night here and there, it can be okay because you don't want to overtax the battery. Or more importantly, overtax the compressor that's pulling the oxygen from that perspective.
Thank you. I'm going to bring you the mic, Dan, so that people online can hear. And I'm also going to invite Jenna to come back up so that we can ask both of you questions at the same time.
This is on portable concentrators, but use it for extensive traveling. And yes, you can use it for 24 hours.
Oh, okay. Thank you very much.
Check with the manufacturer, this type of thing. And you're going to find very little help locally. You're going to have to call your airline to see what their requirements are. And it's very difficult for a person just starting out with COPD. Who should they call for help?
Okay, so in what circumstances?
Okay, just to do with concentrators.
Okay.
Whether I should stay with the tanks or I should go to the portable.
Okay, so within Fraser Health, and I know with Vancouver Coastal, there's the within the province there's the home oxygen programs, and there's a respiratory therapist attached to those programs. So I can speak to Fraser Health because we have extensive services that our clients usually reach out to us and ask us to come and assess them, just to review what is the best oxygen equipment to use for their portable use. So I would go in and do that 6-minute walk test and have them use the pulse mode to make sure. Yeah, okay. Okay. Right. Yes, it does. Yeah, yes, the oxygen vendors do not. It's a supply chain issue is what we've been told. And so we have a number of our clients, regretfully, have to be on wait lists. And we're not happy about it either. Definitely, no, yeah. Yes, yeah. There is great advantages with the portable oxygen concentrator versus the cylinders. The difficulty is the oxygen concentrators, the portable oxygen concentrators are meant to give the pulse mode. And so when you move to that stage where you need that continual flowing, then unfortunately we do not have the technology for the concentrators to be able to be used for portability, and that's when you have to transition to the oxygen cylinders. Yeah. Yes, the portable does give you freedom, but for those who are wanting more information in regards to the transition, a respiratory therapist would assess, usually checking to see does a pulse mode maintain your blood oxygen level, and I forgot to mention it in my presentation, that we try to keep your oxygen saturations 88 to 92%. And so as you're walking, we want to make sure we get that sweet number. And if we can do it with the pulse mode, then that makes your life a lot easier, because then we can transition you to, or have you use a portable oxygen concentrator, or more importantly, your oxygen cylinder will last longer because you're only given oxygen on inspiration instead of it blowing to the atmosphere on exhalation. But if during the walk test and we can't keep your oxygen saturations at that sweet level, then we have to go to the continuous flow because we want to make sure, we want to preserve your heart function and make sure that you have a good quality of life. Because if your oxygen level is too low still, then you're still going to have those other effects that, we don't want to have a negative impact on your life.
And whenever you're involved with something like this, read this fine print.
Sorry, read the what?
Read the fine print.
Yes, yeah. Well, read the fine print of a lot of things.
I think that's good advice for everything. Read the fine print. Darcy, yes. Let me bring you the mic.
Just to be clear, I'm asking this for a friend. What do you recommend for cardiovascular exercise if someone has knee and hip issues?
So that is a good question.
Check. No, yeah, right. Night dancing.
1, 2, 3. So that's a great question, Darcy. It speaks to sort of how these exercise prescriptions can be individualized. Pulmonary rehab programs are often a multidisciplinary team. I'm going to take my stab at this question, but I would say with the caveat that a physiotherapist or a kinesiologist can probably give you more specific information. So in our pulmonary rehab programs with knee issues, we usually go to the bike. So have you tried a bike? So yeah, the weight bearing on a treadmill, for example, or with walking can be a lot, and so sometimes the recumbent bike or the little leg ergometers can be helpful. How did it feel like when you were on a bike? Okay. Won't even go there. Yeah, so these little things come up with our body for sure. And so just being able to access those healthcare professionals that can fine-tune that plan and kind of keep you going. Do you kind of know what's going on with your knees, like it's arthritis? Okay. So, And I
do it slowly so it's not too bad on the knees when I
Okay. So, amazing. So one thing you could use on your rowing machine is just that intensity check. So that check in to see, are you getting a good cardio workout by checking in with your Borg scale? So if you're able to go at a pace on your rowing machine where on that shortness of breath scale you feel that 3 to 5, so you could talk to someone while you're rowing but perhaps not sing, then and you're getting that intensity check, then go for it. If it's working for your knees, then that's the intensity that will work. But if you feel like you're on that lower end of the Borg scale, like a 0 to a 2, it just might not be quite enough to get that workout. Yeah.
80% of any successful physical venture is what you put in your mouth, and 20% is exercise. So thank you. You've answered my question. I'll just keep at it.
Okay.
Yeah, thank you very much.
Anyone else have a question? I have a list, but I'll save mine until, make sure everyone has a chance. Dan, you've got another question? Let me bring you the mic.
For what you've been doing. Especially when you first started out.
On oxygen, they send someone right around your phone
Right.
to see if you're using it properly. Then they wait a couple of weeks or a month to come back again to have a look again to see that you're using it properly. And that makes a big difference, and it's a big pat in the back for you.
Well, thank you for letting me know that so I can pass that on to my colleagues. We like to hear that. We as medical professionals, specifically, especially with people with chronic disease, we try to make a positive impact on your life, and it's nice to know that we are actually doing a good job. Thank you.
Okay, I've got a question that's maybe for both of you or either around oxygen and exercise. So if someone needs supplemental oxygen and they want to exercise, how does that work, or what are some things that people need to think about?
So, Armenia, if you want to do the criteria, then I could talk about like the practical aspect of it.
Okay, perfect. So when your oxygen level, the 6-minute walk test is the standard, and it's a little different than one with your exercising. So we have you walk for 6 minutes, and if your oxygen saturation falls below 87%, then we get you to repeat the walk test with the oxygen. And determining how much flow to maintain the oxygen sats at 88 to 92% will then be what your prescription is. But that's for 6 minutes, right? While you're walking on a flat surface, you're walking with your walking aids, you're walking at your pace. So when you're exercising, it's going to be a different situation.
That's right. So, so first off, and just some practical tips. So, do wear your oxygen if it has been prescribed to you for exercise. Like Armenia pointed out, we want to optimize the lungs, but we also want to optimize the heart, and we're working out both of those things when you're doing exercise. Some things to keep a note of. So remember, your oxygen is going in through your nose through that tubing. So using your controlled breathing techniques like pursed lip breathing, where you really focus on inhaling through your nose and exhaling through your mouth, is going to be really helpful to make sure that the oxygen from your device into the tubing is then going into your nose and down into your lungs. What happens with exercise sometimes is as you breathe a little faster, you might get a little panty. So you start to breathe in and out through your mouth. So you just really want to be conscious that you're breathing in through your nose. You also want to use the equipment depending on what your activity is. So of course your portable equipment, but if you're exercising at home hooked up to your concentrator, for example, with that long tubing, just trying to be safe, making sure the tubing's out of the way. Sometimes you can put it over your chair, over the back of your chair, so you don't get tangled up in it. So there's a couple little practical things to kind of think about, but certainly exercising with oxygen is very doable.
Thank you. I have another question, unless anyone else has come up with something. Jen's full of questions. Before I do that, I'm going to take a second while I remember it to just point out to everyone that you have this evaluation form on your table. And so please, at some point before you leave today, to take a moment to fill it out and leave it for us so that we can just make sure that we take your preferences into account and improve for the next time. Dan, I'm going to sneak one question in and then I'm going to come back to yours, if you don't mind.
Start exercising, becomes shortage of breath.
Right.
So if I turned it up a little bit, it was good.
Yeah.
Now if I cranked it up to 10, it should be really good. It was while I was in the hospital.
Yeah.
Right down a little bit at once, you're going to go up on heart pressure.
And you're right. Usually we want to avoid the tendency because you feel relief with your breathlessness by wearing the oxygen, so someone just puts it up by 1. And then they keep putting it up and actually never really dealing with the possible reason of why are you needing more oxygen. Because it may not be, are you just breathless because of the act of breathing is difficult? So do we need to change your breathing medications? Do we need to do, like Jen is suggesting, using the breathing techniques a little bit more often to help with the breathlessness? Or is this a tip of, or a hint saying that, guess what, maybe you're coming down, maybe you're having a flare-up. And so that's when you need to be speaking to your doctor, because regretfully, you see that in the hospital. Oh, they just put my oxygen up and you're going to just do it at home so I don't have to go to the hospital, right? Then you're just going to get yourself in some serious trouble.
Thank you so much. And I have tons more questions, but I'm going to hold them because I think it's time for our next presenter. So I'll let Darcy introduce her. Thank you both so much for all. That was super helpful.